Good morning, Chris Ohl, Wake Forest School of Medicine, Infectious Diseases, for our weekly COVID update. So the update today is largely positive. The Delta wave in North Carolina and the Triad region is subsiding. It's interesting to look at the curve, though. Where the rise in cases in August went up very steeply and quickly, they're falling a little bit more slowly. And so we have a curve that has like a skew on the end, kind of like a ski hill a little bit. And so we'll have to be a little bit patient for our case numbers to come down some. Here in Forsyth County, as of this morning, we're running at 25 cases per 100,000 people per day, which is about half of what it was, a little less than half actually, at the peak around Labor Day. Across the country, the cases, the Delta wave has largely moved north. And so some increase in cases in New England, but particularly Minnesota, parts of northern Wisconsin, North Dakota, into Montana, and those areas. Why is that? Oh, multifactorial. They were largely spared the Delta wave in September. So the virus has to burn through their populations, either with first-time or breakthrough infections for the vaccinated. And also, it's colder up there now, and so people are spending more time indoors. The Delta variant, just like the ancestral COVID virus, SARS-CoV-2, tends to favor cooler conditions a little bit, and it also gets transmitted much more readily in close places. So if you go indoors and you're spending more time indoors with other people, transmission factor is going to go up, and so more cases will occur. So the North is going to have to burn through, based on our experience and experience in the South and Arkansas and Missouri. They got about 2 months to get through it all, and so we wish them well. Of course, they can mitigate their spike and by masking and social distancing again, by getting vaccinated, and to some extent by getting boosted. That's largely how it's done. In our area, the schools are doing pretty well. There's still cases occurring in schools, talking to my contacts there. The usual scenario is a family. One in the family gets it, and then the rest of the family gets the infection. If the adults are vaccinated, they'll about a 50-50 chance they'll get a breakthrough infection. If there's unvaccinated kids in the family, the chance of them getting infected is higher. A lot of schools are doing some testing now, including screening testing, and some schools are offering testing for symptomatic kids, which is useful because is it a cold, is it a flu, or is it COVID? And you can find out sometimes with your school nurse. So check with your school to see if they have that. It's not anywhere close to 100%, but particularly some of the private schools are offering that. And then there's also a chance for a test to opt in to get back to school to reduce the length of quarantine time, and so that the times of doing virtual learning can be shorted. Our university, we had a little bit of a wavelet. It wasn't really a huge number of increased cases at Wake Forest following fall break. And during that fall break, some of the students went to playgrounds for students where they, for vacations basically, and picked up coronavirus and brought it back. Interestingly, the wavelet didn't really blow up like it did last year in mid-fall, and that's because 98-99% of the students at Wake Forest are vaccinated, and so the virus burden just cannot move itself forward even if cases are introduced into a congregate setting such as a dorm. So that goes to show you how good the virus is or how good the vaccine is when you have a large number of people vaccinated. So a few lessons in that. We all saw in mourning Colin Powell's passing of COVID. I mean, he was in his 90s, so he's at high risk. He had multiple myeloma also, which is a immunocompromising condition that reduces the amount of antibodies that you can make following vaccination. So even when people who are severely immunocompromised, such as he was, get vaccinated, they don't respond as well. And so they're at a much higher risk of getting COVID or having a severe outcome if they do get COVID, and that's what we saw. But you know, if you would think about it, if we would have over 90% of the US population vaccinated, then the virus wouldn't be circulating. His chance of getting exposed and getting COVID would be much, 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 much lower. So it's the same thing. If you surround yourself with people who are also protected, the infection no longer exists in that population. Look at measles. You know, when we have these measles outbreaks in the last few years pop up, surprisingly, it's in unvaccinated people. And then there are a few vaccinated people who are in contact with them who can get a breakthrough infection of measles. So it really is an example of how, of what herd immunity is. And that's when you have so many people in a population that are immune. It protects everyone in that population, even the immunocompromised. So as our case numbers start to come down, I've been asked, when are the masks going to come off? Well, I think the CDC's got it about right, that for masking to be abandoned would have to come about with minimal transmission in the community, which is basically a persistent less than 5% positivity in tests, and a case rate that's around 10 or less. So we're at 25, and we're headed down. So you know it's probably in our future. And then their percent positivity is about between 7 and 7.5. So that's also coming down. And when do I predict it'll come down enough? It's probably going to be sometime around Thanksgiving. And so I would recommend for the governmental bodies in our area to keep with the mask mandate for another 3 to 4 weeks or so. The one thing about the mask mandate is that if you have a municipal mask mandate, then it's a lot easier for the schools to mask. And it's important for our schools to mask right now, and probably will be for a while because our kids are not vaccinated yet. Now, once we start vaccinating the 5 to 12-year-old group, if we can get enough kids in that age group vaccinated, and then we can start talking about taking masks off in schools. Speaking of getting our kids of that age vaccinated, it'll be the first week in November. That's when the ACIP has set the date for their meeting to how to recommend the vaccine. The first one out will be Pfizer's vaccine, which is about a half of an antigen dose in the vaccine. And the kids respond real well to it. In fact, data's come out that it's about 93% effective, both for mild infection as well as severe infection. So it works pretty well, and no adverse safety events were noted in the trial. How the vaccine gets rolled out, we're starting to talk about now at the level of the state and the federal government. Vaccine initially will be probably have a demand greater than the supply initially, so people have to be a little bit patient. But it'll move a lot faster than the initial rollout of vaccine did last winter and spring. And so it'll come out in 3 waves. We will have a few sites here in Forsyth County that are in wave 1 that'll get the initial shipment of vaccine, including the county health department and Wake Forest Atrium Wake Forest Baptist Health will be also in wave 1. And we're working out in all of these areas and which clinics and which pharmacies and which doctor's offices will have vaccine for 5 to 12-year-olds. It's important that you don't just go to a place to get an adult vaccine for a 5 to 12-year-old, because it's a vaccine that has more antigen in it for adults. You want the half antigen vaccine that we would use for kids. So stand by, and I think in the next week or so you'll see more specifics on how that's done. Also talking with the health department potentially about having some Saturday events at schools so that we can get our school-age kids vaccinated with their parents present. Most 5 to 12-year-olds want a mommy or daddy to hold their hand when they get their shot, so we want to make sure that that's possible. Once our kids start to get vaccinated, and if we can get a significant number of them vaccinated, now we're talking about getting into the areas of immunity that are going to really make it hard for the virus to circulate. So if you're interested in having Christmas holiday plans, Hanukkah holiday plans, you'll want to get your kids vaccinated. We're between 5 to 12 and from 12 to 18. It's going to make travel a lot safer. It's going to make it a lot easier to get together with vulnerable people like grandparents. And it's going to give you a lot of peace of mind. And I think that we'll have more travel and more family gatherings over Christmas this year, and I think that'll largely be okay, as long as people approach them in a realistic way and get themselves vaccinated beforehand. And remember, you need to have the last dose of a 2-dose series at least 2 weeks before you have the holiday gathering or travel. Our respiratory virus season this year is going to be different than it was last year. Last year it was all COVID, 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 COVID. This year we're going to have some COVID, some flu, some other viruses. But respiratory virus season will still be here. And I'm predicting it's going to be a substantial one. But it won't all be COVID. And people will need to get tested because we'll have a drug by then, I think, for COVID that can be gotten by prescription, molnupiravir, that could be given to people who are at higher risk of having bad outcomes from COVID, or it could potentially be used to prevent COVID amongst people who have a higher risk of a bad outcome. And then we also will have Tamiflu, of course, for influenza. So a little hard to know which virus to treat if you don't know what it is. So doctors' offices need to look at and start ramping up on point-of-care testing so that they can do these testing in their pediatric and adult care offices and have the result right there so they can write a prescription that people can get at the pharmacy. I think that by the time we get into March to April, which is usually when our respiratory virus season comes to be an end, we can start to breathe easy and really think about it being towards the end of COVID. With one caveat, that if another mutant variant comes around, it could slow our recovery again, just like Delta did. There's a variant in the UK now. It's got a number. I forget what it is right now, but it's basically a mutant of the Delta variant. And it's about 8% of people in England right now where it's been circulating. But of interest, it's been circulating since early summer, late spring, when it was first identified, and it's still only 8%. So it may not have much more increased transmissibility or fitness than its parent Delta variant. But it's worth keeping an eye on, and has not been listed yet as a variant of concern by the WHO or the CDC. So, boosters. I am standing by to cut through the confusion about boosters, but I'm gonna wait on the final thought on it until after today, because today the CDC's ACIP meets basically to map out a booster strategy for the country. It's going to look something like this, and I'll post it on social media and Twitter. Probably it'll be tomorrow, so people can look at it. The first thing you have to do is decide whether or not you need a booster. So who really needs a booster? There's a difference between needing a booster and wanting a booster, okay? Who needs a booster? Are people who are older, over the age of 65, and anyone between the age of 50 and 65, particularly if they have underlying health conditions, or people who are at high risk of being exposed or having transmission occur, such as a residential university where people are living in dorms, or nursing homes, obviously, or places like that where people have a high risk of exposure. Those are people who need a booster. The other group of people who are going to need a booster is anyone of any age. Right now it'll only be over 18 because it's not authorized under it, is who got a J&J vaccine as their initial vaccine. They need a booster. And I'm going to stop even calling it a booster for J&J people. I'm going to call it a second shot, because it should have been a second shot series all along. I've been saying that since last February. It's that group of people, more likely than not, will benefit from getting a messenger RNA as their second shot rather than getting a second J&J. They can get a second J&J, and that'll help, and that'll bring their immunity up, but it'll come up a little bit better if they get a messenger RNA vaccine. Moderna or Pfizer, it's largely not going to matter much. In the antibody measurement trials, Moderna looked a little better, but they're probably both in a range that's good enough. So, so for you J&J people, stay tuned, because you may be able to go out tomorrow to get your second shot. And Dr. Ohl recommends you get a messenger RNA vaccine rather than a second J&J. Now, there are a few stipulations about that. And if you have a contraindication to one of the messenger RNA vaccines, such as an allergy to one of the components or something, then it might be worthwhile to get the second J&J instead. If you're concerned about the very, very rare and small complication of myocarditis in a young male, 18 to 25, again, it's like 50 to 60 people per million, so it is a very rare event. But if that concerns you, then get a second J&J shot, and that'll boost you up. But everyone who's had J&J should get another shot. Now, for those of you who've gotten Pfizer or Moderna, and you need a booster, over 65, have underlying health problems, or university student or something, is it going to matter to you whether or not you get the same vaccine that you got before? It probably doesn't make a big difference, but I think the ACIP is going to suggest that you get the same one that you got before, because we have better data for that. So if you were a previous 2-shot Pfizer person and you need a booster, then you can get another Pfizer. If you were a previous Moderna person, you can get a Moderna. But if for some reason it flips, maybe you go to the clinic and they don't have any Moderna that day, get a Pfizer, it's okay. It'll be just as good. So, and vice versa. So that's a little bit about where I think the boosters are heading. And once the ACIP comes out, I'm going to make a neat little graphic so you can follow the roadmap down and figure it out. It may be that the FDA will suggest that, or the ACIP will suggest anyone that the age would be anyone down to 40 needs a booster. I'm not so sure about that. But that's where the booster world's going. At some point, it'll become a standardized way and approach, I think, for all 3 vaccines to be given. And so the confusion will be even less. So with that, I can go ahead and open it up for questions. Oh, there's one I already have. What is different between booster doses and the original doses? As far as the vaccine goes, for J&J and Pfizer and Moderna's vaccine, there is nothing different about the booster than the original doses. It's the same vaccine. Sometime it will be a little different, but right now it's not. And what is different otherwise is that you really needed a 2-shot series to become immune and then to be considered fully vaccinated. You will still be considered fully vaccinated if you have the original series and haven't had a booster, at least right now the way it is. You'll still be considered fully vaccinated. So that's, I think, what the differences are. Any other questions?
We have one about vaccines for kids under 5, asking if you had.
Yeah. So a question about vaccines for kids under 5. Those studies are still ongoing. They're enrolling pretty quickly, though. I think I've seen some early indications that it might be towards late winter, early spring for them. But we are working on it. We haven't forgotten about the under 5.
Someone asked if teachers need boosters.
Do teachers need boosters? I think that it's a good idea for a teacher to get a booster. Yeah, I do. And I also think it's a very good idea for everyone to get a flu shot this year. I didn't want to forget that. Can't forget about flu. I can tell you from my own personal experience that most of my bouts of flu or influenza were worse than my own breakthrough infection. So get your flu shot. Any other questions?
There was a little confusion with if you're vaccinated and you're saying, surround yourself with vaccinated people. They're asking if unvaccinated people are the only ones that can infect people, or?
Yeah, so the question is about vaccination versus unvaccination and how much of a vehicle you are to transmit to others. And I went over this last week, but I'll go over it again because it's a good point. So if you think about it and you make a graph, and we should make this graph actually and put it up on the media, you could be either vaccinated or unvaccinated, right? And the person that you could potentially transmit it to could be vaccinated or unvaccinated. So you have 4 different ways of looking at it. So the way that transmission is most likely is from unvaccinated to unvaccinated. And that's pretty high. In a household, it's like 70%. It's almost a sure thing. If the next highest is an unvaccinated to a vaccinated person. The next highest after that is vaccinated to unvaccinated. And the next on it down the road would be vaccinated to vaccinated. I'm saying next highest, but what I really mean is lower. So the lowest risk would be vaccinated to vaccinated. The highest is unvaccinated to unvaccinated. And then the other 2 are in the middle. So the more vaccinated people in a population, the better. So if you want to surround yourself with in a community with very low risk of COVID, get everyone in that community vaccinated, and the risk goes down to almost unmeasurable. So, other questions? All right, we'll meet again next week so we can go over the final thing about boosters and then talk about what holidays are going to look like.